All right, so 100 ups I call these, and the drill, the name is, this is a common running drill. Name is because you do 100 of them, okay? You don't have to start with 100, but that's just the name that was given to me when we learned these. So Michael's gonna go up and bring one leg into stance phase, okay? Again, that 45-degree coming off, squish the bug position, okay? Glutes engaged, he's pushing into the wall really hard. The harder he pushes into the wall, the more he's gonna engage the abdominal wall. Again, it's about teaching these, the glutes and the abdominal muscles to work, so he's not getting any pelvic shift or drop. All he's gonna do is he's gonna switch legs, and as soon as he hits the ground, engage that glute. Teach the glute to turn on and be the first thing that activates when you hit the ground. Good. I like to put a mirror beside patients at home, have them do it beside a mirror so they can see. The head should not go up and down. You see a lot of athletes that do this and they wanna jump off the toe. If you're jumping when you're running, you're going up, and that which means there's more force against the control when you come down. So it's really with this drill, trying to teach patients how to move through their hip joints, and then at stance phase, activate those glutes. And we can see with Michael here from the back, is a little bit of side to side shift, right, as he goes here. So a lot of that is him pushing into that wall to activate those rotary stabilizers so that he's not letting the body go like this when he lands. There you go. Harder you squeeze with this one, the more you're gonna get out of it. So I have patients squeeze as hard as they possibly can. Another great cue as you're doing this, you gotta breathe, right? You gotta figure out that breathing piece. So when the abs are down, trying to air exchange through here, trying to get that diaphragm to kick in and push down into the pelvis and get that air exchange happening through here versus up through the chest. The progression from 100 ups, come over here, Michael, we're gonna be facing this way, ideally in front of a mirror at home. We're gonna get him back into that stance phase position, okay? Abs really tight, glutes really tight, okay? And he's just gonna do a quick switch here where he brings one leg down, the other leg's coming up, okay? Same glute activation, stabilize, trying to use momentum. That elbow drive is really important. The more the athlete drives that elbow back, that fascial tension can help to really stabilize, okay? Squeeze, 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 good. And the common problem here is a lot of athletes will drive forward a bit too much. Again, arm drive coming forward is gonna wanna kick you back up. So really emphasize with patients that elbow drive back and almost have that forward arm stop right about the torso. Okay, as opposed to coming way up here, okay? Now, sprinting mechanics is a little bit different, but for these endurance athletes, have that arm drive stop a little bit shy, good. Elbow back behind you is great, okay? And again, in the mirror, Michael will want to make sure he's not going side to side, staying nice and stable, and just not moving the body at all, just driving through the hips. Great one to do post-run when athletes are pre-fatigued, so they really can really learn how to engage those muscles once that fatigue is set in.